Welcome back. We're continuing to track the latest on COVID-19 and the Omicron variant. Our next guest is here with us for more. Dr. Ali Raja is professor at Harvard Medical School, and he joins us now. Dr. Raja, thank you so much for being here. The United Kingdom just came out with a study today saying booster COVID vaccines give an estimated 70 to 75% protection against mild infections from Omicron. Taking this together with the news out from Pfizer earlier this week that their booster with BioNTech neutralizes Omicron, how should we be thinking about the risks of this new variant?
It's a great question, Emily. I think the thing that we can take away from these data, which are coming out every single day and really informing and changing the way that we think sometimes, is that the two shots that we've gotten thus far have been great for the variants prior to Omicron, for Delta and for the variants prior to that. Unfortunately, what we're seeing is that the two shots just aren't effective enough for Omicron. And to really get the protection that we're going to need, as we start seeing a higher proportion of Omicron cases, we really need to get the booster.
So when we look at all of this going forward, we know to get a flu shot. A lot of people we know are objecting to getting the COVID-19 vaccines. That's their decision. It might be a very bad one. Is there a way scientifically to just combine these vaccines into one that would make it just very simple and call it a day?
It's a great question, Adam. The fact is that what we need to figure out first, and we're still in the process with these COVID vaccines, is just how frequently we might need something in terms of a vaccine. We know that the flu season, which we've known around for hundreds of years, varies in this annual pattern. And so we know that we need one flu shot once a year and that that's generally going to be effective at protecting us. What we don't know yet is how often we're going to need these COVID shots. Right now, we've gotten two, and we need a third, but there's a pretty good chance that we're going to need another one in the next 6 months or so. Once we figure that out, we can start thinking about combining vaccines to make it easier for everybody.
Dr. Raja, what do you think needs to change at this point in order to get the vaccination rate for, of course, the first two doses or the single dose of Johnson & Johnson across more of the U.S. population? And then, of course, now with boosters being authorized for a broad array of individuals as well, what do you think needs to change in order to get these rates up?
Well, it's really interesting, Emily. Unfortunately, what we've seen over the past few weeks as the Omicron cases have been found here in the U.S. and across the world is that we're seeing an uptick in patients getting vaccinated. And, I don't want it to take a rise in cases to prompt vaccinations, but if that's what it takes as one of the things that prompts people to get vaccinated who were hesitant before, then I'm all for people getting vaccinated. But we still need to be convincing our family, our friends, our patients, everybody we know, whenever we can. The more we talk to people who are hesitant, the more we can convince them of the right thing to do.
The move by Middlebury College to remote instruction, they've had an outbreak there. Is that an overreaction?
I really don't think so, Adam. And here's the reason. So it's 3:15 here. Middlebury College at about 5 o'clock is going to switch to remote instruction. They're not going to have in-person dining. They're going to have to-go bags for food tonight. And the reason this is not an overreaction is we know they're shutting down soon for the Christmas and New Year holiday break. And these kids, they've got over 50 cases now, are going home to their older parents, their grandparents, and are likely going to see them. And so it's not an overreaction at all. They need to limit this spread right before their kids all go home.
We're seeing TSA throughput data for the holiday travel season really getting close to that 2019 pre-virus level here. What tips would you have to those who are trying to travel for the holiday season? And should people feel safe to do so, especially now that we have these new variants?
It's a great question, Emily. Right now, I'm not recommending, and I'm not changing my holiday transit plans as well, and I'm not recommending it for my patients. What I am saying is that we need to be extra cautious. Fortunately, the TSA and the airlines and the airports are requiring things like masks and hand hygiene everywhere, and that's a great start. But the other thing is to remember and act as though we can still get breakthrough cases. So if you can physically and socially distance, please do. If you're going to be around people who are not vaccinated, take a rapid test before you go visit them. Do everything you can to limit the spread.
I want to get back to that Middlebury issue, but also the fact that states that have very high vaccination rates, where we're seeing, I think it's Vermont, we see the increase in breakthrough cases. Are people like you, or at least the authorities that track this kind of outbreak, Are they differentiating between breakthrough of 2 doses or this person had the booster? Do we know if the boosters are in fact preventing breakthrough?
That's a great question, Adam, and one that I unfortunately don't know the answer to. What I'll tell you is that the cases that I've seen during my emergency department shifts this past week, the few cases that I saw breakthrough cases were with people who had gotten 2 doses. I haven't seen that many breakthrough cases of people who have had the booster.
All right, we'll leave it there for now. Dr. Ali Raja, professor at Harvard Medical School, thank you so much.